Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has muted so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all to Dr. Pat O'Malley. Dr. O'Malley is a former pediatric intensive care, emergency medicine, and palliative care physician. She is currently the medical advisor to a new pediatric bereavement program for Mass General for Children that provides support and resources to families who have experienced the death of a child. She joins us today to give a talk on supporting a child through loss and grief. So please join me in welcoming Dr. O'Malley.
Thank you all so much. Thank you, Amy, and the Blum Center. And where are my slides? Where did they go? There we go. I'm very happy to have this opportunity to talk to you about this important subject, and would like just to, at the outset, would just like to say that I am sensitive to the likelihood that someone coming to a talk like this, thinking about supporting the grieving child, is likely to be themselves a grieving person. And even if that is not the case for you, I would say that as we speak of loss and grief, it oftentimes brings back to us past losses in our own lives. So I would ask that we keep this a safe space as much as possible, that we respect our own emotions and the emotions of other people participating, and that things that are shared here should stay in this space as much as possible. So I do have a few objectives. I would like to tell you all about the MGFC bereavement program, because it's now entering its third year. It started as a 2-year pilot and has continued with generous philanthropic support from the Parmenter program and the Collins Joy Project, to which folks we are very grateful. So I'll tell you a little bit about that program, which doesn't focus specifically on children, but rather on bereaved families who have lost a child who is cared for here at Mass General. And I'd like to give a few definitions, numbers, and a developmental context for childhood grief. And we can focus on what we have learned the grieving child needs, and some thoughts about how we can talk with a grieving child. Then I would love to hear from you all any final tips from your toolbox, any resources, and we can review takeaways. So our bereavement program began in January of 2022 with the vision of serving bereaved family and clinical caregivers following the death of a child who was cared for at MGFC in an equitable, sustainable, and meaningful fashion. And as I mentioned, we're especially grateful for the generous support from the Department of Pediatrics for the first 2 years of the pilot, and now currently the Parmenter Foundation and Collins Joy Project. Our program staff is Mary Barbara Boussier, who is a licensed independent clinical social worker. She is the program manager and the heavy lifter. I'm the medical advisor, and we've been blessed this past year because of the philanthropic support to be able to have Mary Claire O'Brien Wilson as our spiritual care provider. We also have a bereavement advisory committee, which consists of several bereaved families, as well as representatives from various parts of the pediatric hospital. We're hoping to have a specifically parent advisory committee, and we're working on that. That is a goal for 2024 for us. So what do we do for families? We follow up with the family after the child has died at specific increments to provide ongoing support, mental health assessment, and resources for a 2-year period. And families are free to opt out at any time. We haven't had any families that I can think of who have opted out, however. The initial outreach, which typically happens within a week or so of the child's death and may involve several contacts during that first month. And then at 6 months, 1 year, 1.5 years, and 2 years, with some milestone phone calls as well throughout the year. For instance, on Mother's Day, Father's Day, and special holidays, as well as the anniversary of the child's birth and the anniversary of the child's death. And the program also provides support groups throughout the year, and these have thus far been loss specific, which is to say, one of the support groups, the first actually, was NICU losses, babies who died while in the NICU or within the first year of life. And the second one was specific to children who died through trauma. Mary and Mary Claire have started a monthly drop-in support group, and I think are very happy to have that off the ground. So that is advertised in their newsletter, and anyone who would like to drop in is free to do so. The program has also put on several educational and interactive webinars: grief around the holidays, sibling grief with a child's life specialist, which is a terrific talk I can recommend to you all. And Mary Claire presented on spirituality and grief. We have reestablished a yearly memorial service. The first one was last fall, and we're hoping to reestablish that again for this fall. The team puts out a monthly newsletter with program events, outside resources, and you can contact the MGFC bereavement program at mgb.org to get yourself put on the distribution list. Mary will also provide one-to-one therapy, which you can book Mary and Mary Claire. You can book either with Mary or Mary Claire, social worker or chaplain, which can be a short-term bridge for finding an outside community clinician. There is a specific focus during Bereaved Parents Month in July, where special mailings are sent out to the families. And increasingly, the program is finding ways to connect bereaved parents with other parents or families who've had similar experiences. We also focus on the care of the clinical staff who have been involved in the care of a child who dies. And we put out a death notice email, which is actually very important for clinical staff who, particularly those who rotate off of a unit for a child they cared for subsequently dies, and they may not learn of the child's death until much later. So this allows for timely knowledge on the part of people who were touched by the care of the child. We also facilitate what we call caregiver gatherings following the death of a patient, either on the floor or in the PICU or NICU. I participate in that along with Dr. Anna Abrams, who is one of our child psychiatrists, and Mary Claire O'Brien-Wilson. And the intent of caregiver gatherings is to allow the staff to come together as a bereaved community. The cumulative losses that clinical staff experience, I think, are given very little space in our professional lives. So this is an effort to provide that space to allow them to process the death, the impact on them, to honor the life of the child and to honor the care that was provided. We also do education for residents, also outside MGB outside MGB facilities like Newton Wellesley Hospital. And we've had several speakers at the Blum Center webinar. There is a monthly drop-in session in PICU, a sort of tea and empathy session with a convenient sample of whoever happens to be in the PICU staff lounge at that time. And we have an advisory committee that helps us focus on finding ways to support staff, ways that we can do that are attainable and accessible. But now to talk about the grieving child. We know as humans that we will grieve any change in our life, in our relationships, home, school, pets, even a body part, or lost abilities, health, possessions, loss of a goal, even the loss of safety, the change of seasons, routine, job, and beloveds. And we know that with loss comes grief, which is the natural response to any change or loss. And grief is a physiologic and psychologic response. It's not orderly, it's not predictable, changes from moment to moment, and it is unique to each individual. We each grieve differently. We also know that everything living will die. We don't necessarily keep that knowledge forefront in our minds, but we know that. And further, we know that 1 in 14 children or youth in Massachusetts specifically will experience the loss of a parent or sibling before the age of 18. There have been many structures given to the phases of grief, and many people are familiar with Elizabeth Kubler-Ross's stages of grief. But I think, practically speaking, it's useful to think in terms of acute grief, which can last easily 2 years, a period of time when there are lots of emotions, intrusive thoughts, and symptoms that are carried in and felt in the body. Subsequently, grief transformed is a period where folks are adapting to the loss, and some of the intense emotions from earlier may ease or subside. And the hope is that grieving people will arrive at a stage of integration where they are able to accept the reality of the loss, find a sense of purpose or possibilities for happiness, and are able to love again. You may hear different types and names of grief. Anticipatory grief is grief that starts before the actual loss, upon learning that loss is possible. And for parents of children with a serious medical diagnosis, that grief can start at the time of diagnosis. You might hear the term ambiguous loss, loss without closure, that's unclear. And I think during the period of the many deaths that happened due to COVID, when people were not allowed access to their loved ones at the time of their death, that gave rise to a lot of ambiguous grief, because without actually seeing their loved one in the dying process, it's very hard to attain closure. Complicated grief is how we describe grief that is disabling and really doesn't budge over time. And disenfranchised grief is where one is denied the right to grieve when loss isn't validated. And I think of the grief of clinical caregivers oftentimes as disenfranchised, when we don't allow the space in their professional lives to acknowledge the grief. Grief is an entire person, a whole body experience, and it will show up in the affective, cognitive, and somatic realms. So affectively, any emotion is likely to show up: sadness, irritability, shock, anger, numbness, relief. And there really is something known as grief brain. The brain just doesn't work at the same speed or with the same accuracy. So worry, loss of concentration, preoccupation with thoughts of the deceased are common ways that grief shows up in the cognitive realm. And grief will show up in our bodies as a stress response, very commonly in children: loss of sleep or appetite, or change in sleep and appetite, and GI functions, headache, fatigue, chest pain, digestive problems, sore muscles. So it's a whole body experience. Let's think about what we've learned that grieving children and youth need. And I think these 4 categories, we'll spend a little time on each of them. They need to feel safe because the loss of someone they love has turned their world upside down. They need to understand what has happened. They need to be able to feel their feelings, and they need to be able to remember or commemorate the person that they've lost. So thinking a little bit about each of those. As children who grieve need safety, because when they've lost someone, they will wonder, think, and question, who's next? Me? You? Who am I going to lose next? Who will take care of me? And some role confusion. Am I still a big sister, a big brother? And I think a very human response that starts very early on as a response to loss is, was this my fault? It's helpful, I think, if you're trying to support a grieving child, to think about the how, when, and where they might feel safe. This photo is of my 3 daughters, and the daughter in the middle, my oldest daughter, experienced the loss of her first pregnancy. Her beautiful son, Avi Lear, was stillborn, one day after his due date. And she feels very safe with her 2 sisters who flank her on either side. They were there with her, grieving with her, and they still provide a very safe place where she could just feel what she feels, express the questions and the emotions that she's feeling. So they provide her safety. But as someone supporting a grieving child, we can ask that too. And it might be different for them where they feel safe indoors versus outdoors, their daytime safe space versus their nighttime safe space. Do they feel safe with friends or with family, school, familiar versus new places? And all of those are individual responses, but learning where a child feels safe by asking them is a good approach. We can help them establish safety through their routines and also in their health and well-being. So what does that look like? That looks like we know there's safety in structure and rituals. So being able to be apprised of what's coming up next. We're thinking that we will make a visit to the graveside next week. So having that announced and expected is helpful. Maintaining a daily routine, which in a grieving household can be very challenging, but is still one of the best ways to establish safety for a child. So here's what my day is going to be. I'm going to get dressed. I'm going to gather my dirty clothes. I'm going to water the plants. I'm going to go to the potty and brush my teeth. All those things that are routine. Stabilizing and maintaining a routine is a very good way to help a child feel safe. And we know that there's safety in rituals, although as we practice them in bereavement, we may need to be very flexible and open to doing them differently and engaging the child in how they might want to do Thanksgiving differently or Christmas differently. We can also provide them safety in their health and well-being, making sure that their diet is still healthy, that they still get exercise, that they make and keep doctor's appointments as needed. And yes, they still need to wear their seatbelts and their helmets and follow the traffic rules and the other rules, like they can't hang up their wet towels on the floor. They actually have to pick them up and hang them up. So maintaining rules that seem perhaps trivial and stupid in the setting of a major loss are still a very important way that lets a child know the ways in which his world or her world has not changed. So how do you specifically help as a safe person? You show up consistently. The questions that you ask need to be open-ended and caringly curious. You're not judgmental of the answers, and you respect confidentiality. So grieving children and youth need to feel safe. They also need to know what happened. And we're not always very good at this, at explaining to children what has happened when a person has died. If you consider the ways we talk about death, there are a lot of euphemisms: asleep forever, in a better place, cashed in, departed, expired, no longer with us, resting in peace. We lost them. A child might ask, well, can't we find them? Checked out, didn't make it, met one's maker, passed away. So if this is passing, what does failing look like? These are all very confusing euphemisms for a child. And it's funny because we don't hesitate to use the D word in a number of other common expressions. Dead end street. My phone died. She's such a deadbeat. I'm dead tired. He's a dead ringer. Even you are dead to me. So using the D word, death, dying, is very helpful and very concrete for children. They need to understand who died, what happened, where did they die, when did they die, how did they die, and maybe the hardest of all to answer is why did they die. But telling children about death, the truth should trump. And we know from a study reported by Kenter and Kaplow in 2020 that when truth is kept from children, children may reenact through play or drawing distressing elements of the death, sometimes with alternate or counterfactual acts or events that depict what children feel they or others could have done to prevent the death. This may be a good time to just review the cognitive and developmental variations in how a child understands death. So in the youngest children, infant, toddler, 4-year-old, they may sense an absence and miss a familiar person, but they're unlikely to understand the difference between a temporary and a permanent absence. So the idea of death being irreversible and forever is not something that they have necessarily grasped yet. So that means that as someone supporting that child, repetition is key. In this age group, somatic symptoms are oftentimes very prominent, with eating, sleeping, and some regression of previously mastered skills. Bedwetting, potty training may all kind of go out the door for a while. They may experience separation anxiety and may be extra clingy. Because at this age, they may lack the language to explain their experience or question what happened. They can't always name their feelings, but they certainly experience the feelings of sadness, anger, frustration. They don't necessarily have the language to talk about them. And as a result, they're often excluded. When we get to slightly older children, 5 to 8 years, they still will expect a person to return. And as someone supporting that child, it may be very painful for you to have to keep saying, no, grandma is not going to come back. Nightmares and sleep disturbances are common in this age group, as are concerns about safety and abandonment. If he died, are you going to die? What's going to happen to me? They may not realize yet that all living things die, although they will likely have experienced dead bugs and dead birds and may have had a pet who's died. It's still not quite within their grasp to realize that this is the common outcome for all living things. And in this age group in particular, they may have magical thinking about what caused the death. They may feel very responsible. If only I hadn't gotten mad at grandma before she died, then she wouldn't have died. I made her die. And this is partly a response that I think is, again, universal. Humans, when they experience loss, experience guilt, and they would rather feel guilty than powerless, because we all think we have some magic, that we all have some power. But children in the 5 to 8 year range oftentimes really do think they have magical powers, and they made their brother die because they wished him dead. You're so mean to me, I wish you were dead. And then that causes them to feel that they were responsible for it. The older child does understand death as final, irreversible, and universal, inescapable. They may have lots of questions about rituals and biologic aspects. They may worry about something bad happening again, and they may have difficulty with concentrating and focusing. And again, retain the magical thinking about what caused this. For an adolescent, there may be a fair bit of confusion over role identity in the family. If the father died and this is a boy, he may feel, am I now the man of the house? If it's a sibling, am I still the younger sister if I don't have an older brother anymore? They do understand death as final and universal. A diminished ability to concentrate is very common and may show up in school settings. And because they're adolescents, they can feel helpless, vulnerable, overwhelmed, and angry at any time, let alone in the time when they have experienced a major loss. It is helpful to pay attention to cultural context as well. For instance, children raised in the Mexican culture typically see many more symbols of death and death rituals early in their life and embedded in their family life through El Dia de los Muertos, for instance, where Euro-American children, in contrast, may have been shielded by their parents from family experiences of death. And it's helpful to consider how differently family is defined, or how intergenerational support is anticipated, or how frequently religious coping is employed in different cultures. The truth isn't always easy to say or to hear. But as we explain death to a child, it's good to stick with the basics. When a person dies, their body stops working. Their heart doesn't pump blood. Their lungs don't fill up with air. They can't move. They can't talk anymore. His or her body stopped working. She died. We are very sad. We all wish that she hadn't died. It doesn't need to be any more complicated than that, but it needs to be that clear and that concrete. And children and adolescents will have lots of questions. And it's okay not to know the answer. So some responses to a question that you don't have an answer to, or you don't want to answer in that moment, I can't give you a good answer. No, I agree, it's not fair that this happened. There is no explanation. I worry about that too. And I love the, what do you think happened? I think that's a terrific way to caringly explore with a child what's going on in their thinking about a death. Books can be very helpful, and one of the handouts for this talk is a list of books put together by our child life specialist, Hilary D'Amato, that I think people will find very, very useful. But I would say when you're looking at books for kids, it's okay to be picky. It's ideal if you can find books with characters in whom your child can recognize him or herself. So if it's a an older brother who has lost a younger sibling, having a story about an older brother can be useful. If it's someone who's lost a grandparent, having a grandparent loss is useful. If it's a child of color, it's useful to have a heroine or a hero who's of color. One of the wonderful books, I think, that each of these is wonderful. When Dinosaurs Die is actually a terrific book of questions and answers. And so oftentimes when you're feeling stuck on a question that a child has asked, you might say, let's look it up in the When Dinosaurs Die and see if that's something that they talked about. So books can be helpful to give you language, to prompt a conversation, and to give a child language for things that they haven't experienced before. So how do you help with a child's understanding? Use the words death and die. Be very careful or sparing of your use of euphemisms. And know yourself what the facts are, what facts there are to share, and be willing to share them. Also be willing to say when you don't have the answers. Take into consideration the child's cognitive age and what they are likely to understand about death and the permanence and the universality of it. Also, be aware and honor your own experience or bias with death and loss. And lastly, clarify the origin of any questions. This is such a good tool to have when you're supporting a child, because they will ask questions where you go, oh, how am I going to answer that? And the best way to respond to that is to position yourself as someone open to, willing to entertain questions, even if you don't know the answer, and say, that was a really good question, or a really hard question, or a really tough question. What got you worrying about that? Or what got you thinking about that? That not only gives you a moment of space to breathe and think, and now how am I going to answer this question? But it also allows you to clarify what the child's concern is. I have an anecdote from my own experience that I'd love to share. As an adult palliative care fellow, I cared for a 40-year-old gentleman who died of pancreatic cancer and got to know his two young sons. And then at the end of my fellowship, I went back to working in the emergency department and actually saw one of those children when he came into the emergency department with a tick bite. And I recognized him. And after we got the tick bite out without any complications, I said, how have things been doing for you since your dad died? And he talked a little bit about that. And I said, oftentimes I know kids have questions that they couldn't get any answers for. Do you have any questions? And he said, yes, I have a question. What causes cancer? And as a pediatrician, I would have said, well, you didn't cause it. Nothing you thought or did made it happen. And you can't catch it. And there are still people in your life who will take care of you. But remembering this tool that I had learned, I said, that's a really good question. What got you thinking about it? And he said, a month before my father died, he was bitten by a tick. And there is no way that I would ever have gotten to that concern of his, to address that concern without asking him. So remember that you can always clarify the origin of any question. And frankly, this is a good technique for anybody of any age, not just kids. So we know grieving children and youth need to feel safe. They need to understand. They also need to feel their feelings. There is no right or wrong way to feel. It's what we do with our feelings that counts. And these are tiny words here, but oftentimes the grief stages are described in terms of shock, numbness, denial, anger, fear, searching, yearning, panic. and then moving towards an adjustment of discovering new strengths and patterns, hope, affirmation, helping each other. But the woman who put this picture together said, my experience was all over the place. Sing, 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 sing. And I think that that's typical, or at least representative of how unique anyone's experiences are. No one necessarily goes tidily through all the stages of grief, but it's a maze. And this is an image from Refuge in Grief, which I think is great, the cartography of grief, because it shows you all the different ways that grief will be experienced. The I don't care at all, the ship of kindness, grief landmines where you just are ambushed by unexpected triggers for your grief, pockets of peace, library of finding meaning, fog banks of the future, the republic of memory, a beauty outlook, cave of safekeeping, the sea serpent of toxic positivity. These are all places that you may visit, that a child or an adult may visit in their grief journey. But grieving children and youth need to feel their feelings. And I think as you look at the expressions on the children's faces here, you will get a flavor of some of the feelings of wariness, of overwhelming sadness, of despair and rage, of loneliness and fear. These are all emotions that kids may experience, and they may not know how to express, and they may certainly, given their whatever developmental age they're at, they may not know how to manage either. How we can help is to be willing to acknowledge, share, and model our own feelings. It's all right to cry in front of a grieving child if you yourself are grieving. Simply to say, Mommy's sad today, and to name the emotion. And that is helpful and supportive to the child, because then they know that that's an acceptable and allowed feeling and emotion, and they don't have to be so alone in it. Use feeling words. Oh, you look frustrated. What's going on? And you can even teach a feeling vocabulary. There's a number of children's books that are simply about feelings, and those can be really helpful, particularly for the youngest age groups. So you can teach a feeling vocabulary, or you can learn the child's own vocabulary for feelings. Hilary D'Amato, in the just dynamite talk she gave a couple of weeks ago, describes an activity that she sometimes does with children, with a series of picture cards that show emotions and a mirror. And she might ask a child to name what the child sees on a particular card, and then says, if you felt that way, what would your face look like? And the child can then make a face that looks angry or sad or scared or confused. And that helps each of you to have a shared vocabulary. Here are some of the other approaches to feeling feelings. The My Many Colored Days is, we frequently will use colors to express or link to emotions, like red being angry and blue being sad. Although one of the books on the list that will come in the handout talks about blue is my happy. So it is useful to find out what color means what for any particular individual child. Making emotion sculptures that allow you to express what's happening. A feeling mandala that you can color in, or a game of weather outside, weather inside. Outside today, it's hot and muggy. What's the weather like inside today? How are you feeling? Foggy? Rainy? Sad? Angry? All right, so we know grieving children and youth need to feel safe, need to know what happened, They need opportunities to identify and express their emotions, and they need to remember the person who died. So commemoration is remembering a person who's died, honoring their memory, and doing something that's done to remember officially and give respect. We know that rituals help in this regard. And I was raised Episcopalian, but I am now the mother of a Jewish family. And I'd have to say that the Jewish tradition provides so many useful rituals around death and loss. And the mourner's Kaddish, which is a universal prayer in Jewish tradition that is said every day following the death of a loved one for a month or longer, is a very stabilizing touchstone that you can go back to. And finding rituals that are personal to you and to the child is a way to approach supporting the child's commemoration. Ways that children can remember the person that they've lost is to sing their favorite songs, look at their picture, carry their picture, raise money in their memory, cuddle with their toys, clothes, or blankets, remember them on special days, make a collage of magazine pictures with imagery reminiscent of them. They can plant a garden in their memory, light a candle, reread their favorite book. These are all things that are ways that children can remember and honor the person that they've lost. And you can help support the child remember their lost person by saying, how do you want to remember him or her? What's one thing you would want others to know about them? And encourage the child to participate, attend, and help plan a memorial. Explain rituals, encourage questions, and be willing to hear about the deceased. I never knew them. Tell me about them. If you could say goodbye today, what would you want to say or do? So grieving children need safety, understanding, to be able to feel the feelings and to remember the person that they lost. So we have about 15 minutes or so left, and I would love to hear from you all. If there are any tips from your own toolbox, any stories or takeaways or resources that you've found that are helpful for supporting the child. And Amy, if you've got any chat offerings, this would be a good time for us to think about them.
Thank you, Dr. O'Malley. The chat is open, so if you'd like to share any thoughts, feel free to enter them in the chat. While we wait to see if anyone has anything to include, we do have a question regarding support groups. For those who joined the session a few minutes late, can you tell a little bit more about the support groups and whether it's only open to Mass General for Children families?
The drop-in monthly support group, I believe, is open to anyone. The support groups specific to NICU loss and trauma, for instance, to this point have been specifically for Mass General families only. But I think that may change over time. So if you would like to reach out to the program, the email, the program email box is MGFC bereavement program @mgb.org. And you can leave a message there, and one of us will get back to you about and if we don't have a resource in our own program, we are pretty knowledgeable about other local programs and might be able to find something that would be helpful for you. I hope that answers your question.
Thank you. Yes, I also included the link to the program in the chat, so you're welcome to click on that, as well as a list of book titles that Dr. O'Malley shared earlier. I shared the PDF within the chat also. I just realized for those who are joining on your cell phones and maybe even tablets, you might not be able to see the PDF file that I shared. So if you'd like a copy of that, feel free to email the Blum Center. I'm going to enter that in the chat at pflc@partners.org, and we'd be happy to share that with you. We do have someone who entered in the chat that they wanted to comment on the importance of describing in detail what a child might see during specific rituals, like a wake with an open casket.
I'm sorry, could you repeat that?
Someone entered in the chat where they wanted to include a comment about the importance of describing in detail what a child might see during specific rituals, like a wake in an open casket.
Yes, I agree. Preparing the child for, like preparing the child for a visit in the hospital, would be to describe what they might see and to give some explanation for it. And another important thing to do is to always identify someone, some trusted adult friend of the child, who can be present with the child throughout, and if it no longer feels comfortable for the child to be there, can help take the child to a different location. But asking a child if or how they would like to be involved in a ceremony, and respecting their response, I think is the most supportive approach. Not every child will want to attend a boring adult long service. However, not inviting, I think, is not to do them justice. So inviting them and respecting their answer, and then making good preparations, exactly as the person in the chat suggested, preparing them for what they might see, and having a good plan B in place.
We have a question from our participant who is asking if you can give an example of what to say to a toddler who is asking if mom is also going to die.
Who is asking, is mom going to die? Or
what to say to a toddler if they ask whether mom is also going to die. So say, for instance, a family member has passed and then they're now asking, are you going to die?
Yeah. Well, I think the truth is best. Yes, I'm going to die. We're all going to die. Every living thing dies. And your loved one who passed away was very sick. And I'm not sick. And your mom is not sick. And we're doing everything we can to keep ourselves and you healthy and safe. So I expect that we will live a long life, each of us. And to the extent that that is true, that's what you can tell the child. And be prepared to tell them that several times.
Thank you. That's all that we have for questions and comments for now.
I have another story I'd like to share about, relevant to the second last point here. Children will surprise you. You can engage and explore their own imaginations. Of a father that I met in a prenatal palliative care consult for their daughter in utero, who was diagnosed with a very serious genetic condition, which meant that the baby might not survive pregnancy, delivery, and if she was delivered alive, might only live for a matter of hours. And this couple had an older child, a 4-year-old little boy, who was so excited about being a big brother. And they did their best to keep him apprised of what they were experiencing, their sadness and loss. And explained in language that was reflective of their faith that the little boy might not get to see his sister because she might go to heaven before she was born. And he took in this knowledge and then said, yeah, but Dad, how does she get to heaven? And the father didn't have an answer for that. I don't know that anyone has an answer for that. And he said, no, I don't know. How do you think she got to heaven? And the little boy sat thoughtfully for a minute and then smiled and said, she's going to go by rocket ship, which is frankly as good an explanation as anybody else could come up with. So engaging and exploring the child's own imagination, and making corrections if you have to for their safety and for their ongoing understanding is useful. But don't be afraid to say, what do you think? In part because that will help you define better their actual concerns and the way they're thinking about things. And in part because it may be a wonderful gift. I mean, getting to heaven by a rocket ship sounds good to me. Be prepared, and I should have said this at the outset, that grieving children, depending at what age they experience the loss, will re-grieve as they go through each developmental stage. They will understand their loss differently. And so you should be prepared for the child to reopen discussions of the sibling or the loved one who's been lost as they come to an age where they understand death is permanent, and where they understand what this means in terms of their own life and upcoming events in their future. I wanted also to share some of the resources that I used in preparing this talk. There is a website known as Courageous Parents Network, and they have a whole library of wonderful resources there, mostly video interviews with parents, not all of whom are bereaved, many of whom are actively living with a child who is actively living with medical complexity. So you will find some bereavement and sibling bereavement resources there. But they also do a webinar series called In the Room. And the talk on April 11, 2024, which is online and archived, is about books for children. And it's interesting in that it has a bereaved mother speaking to her own experience with her surviving children after the loss of a baby. And also two librarians who have some wonderful things to say about books. So I recommend that. And then I have Shelley Len to thank for the structure of what a grieving child needs: safety, understanding, feeling their feelings, and to commemorate. And this was a talk that she gave at Massachusetts Center for Unexpected Infant and Child Death. And their website is also full of good resources, most specifically related to loss through SIDS or unexpected infant child death. And then Hillary's talk, I hope, will be on our MGFC bereavement program website soon. We built our plane while flying it, and our website at the moment is rather slender, but we're hoping to be able to put some of the resources that we have offered to the world once. We've been able, hopefully, to archive them on the website. An extraordinary resource is the Doobie Center, or Dougie Center, is located in Oregon, but is has a resource finder for anyone in the country. So you can go and say, here's the loss I'm experiencing. Here's the person who was lost. Here's the circumstances of that loss. And they will, and here's where I live, or here's what would be convenient for me to access. And they will help locate resources for you. They also have many handouts, how to approach the holidays, returning to school, and things like that. But I can recommend. And our wonderful local resource, the Children's Room in Arlington, is a terrific resource. They are the only folks that I know of around who do a parenting while grieving series that is so supportive of grieving parents who are either contemplating pregnancy or who still have surviving children that they need to continue to parent. Thank you very much for to the Blum Center for bringing this topic forward. I appreciate it.
Thank you. I also shared another resource. I don't know if you have a moment to kind of give some background on this document on how to help a friend in grief.
Yes. One of the handouts that has just been shared is, again, cognizant of the possibility that people attending this talk are themselves grieving as they're looking for ways to support a grieving child. And how to help a friend in grief is a handout that we have shared at our memorial services in the past. That is something that if you yourself are actively grieving, you can share with friends to let them know how they can be most helpful for you. I think many people in our grief-averse culture struggle with how to support a friend who is grieving. And you can look at this and modify it for your own unique needs, but it gives a good template for that. Oh, and one resource that I deserves to be on this slide and highlighted in this talk, which is at the Mass General, is Club Star. Hillary, the child life person who has been our ED, we've been so lucky to have as our ED child life person, is the co-founder and continued engine for Club Star, which stands for Sharing Together and Remembering. And it's for children, grieving children who have suffered either a parental or a sibling loss, not specifically restricted to Mass General families, so open to anyone. And you can find more information about them if you simply Google Club Star Mass General Hospital for Children, and you will get to their website.
Thank you. I'm also going to share one last link. It's a link to our Blum Center website. As I had mentioned earlier at the start of the session, that this session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Just go in there, and then under news, there's a section called Past Blum Center Programs, and that will take you to the YouTube channel. All right, before we end today's session, do you have any final thoughts you'd like to share, Dr. O'Malley?
No, thank you all for hanging in there.
Thank you so much. And for everyone who took the time to join us, thank you. Hopefully you found today's resources helpful. Again, if you're interested in a list of resources shared today, feel free to email the Blum Center. We'd be happy to share them at pflc@partners.org. Thank you so much, everyone. Take care.